so it's 2021. And you might ask yourself, what are the best hair loss treatments currently available? In this video, we're gonna have a brief overview of most effective treatments that you can start using right now. Make sure to subscribe to the channel for more hair loss treatments, hair transplants, and my personal hair transplant journey. I'm already booked for my second hair transplant surgery in the beginning of June this year, 2021, so more information is coming up really soon. Okay, let's start from the best and safest treatments, following by less effective. In 2021, the best way to treat male pattern baldness is still via blocking DHT, which means finasteride or dutasteride. It's a shame that over 20 years later, since finasteride has been discovered, we still don't have any other better treatment. 1 mg of finasteride per day has been FDA approved for treating male pattern baldness, and it's known as the ultimate dose of treating androgenetic alopecia, providing best efficacy and safety profile. It reduces DHT by around 60 to 70%. However, there have been a couple of studies showing that as low as 0.2 mg a day dose can be as effective by blocking roughly 50% of DHT. And how much it will be enough for you, nobody really knows. It will be up to you to find out your optimal dose via trial and error. Dutasteride is an older brother of finasteride, which reduces DHT over 90% in the body and targets 5-alpha reductase type 1 and 2. Although from what it's known right now, type 1 does not really contribute into hair loss. Dutasteride has not been approved for treating male pattern baldness by FDA. However, in some countries like South Korea or Japan, they approved 0.5 mg of dutasteride per day in treating hair loss in men. It's been shown to be much more effective than finasteride. However, reducing DHT to this low extent can cause hormonal imbalances, thus creating more potential side effects. So majority of people will greatly benefit from 1 mg a day of finasteride. However, dutasteride sometimes can be prescribed off-label. We can also include topical finasteride and dutasteride at this point. So topical finasteride has been proven to reduce the scalp DHT almost at the same amount as oral version. However, it reduces serum DHT much less, so roughly 50%, thus decreasing the potential side effect. There is not much information about topical dutasteride except few studies on dutasteride mesotherapy, which involves dutasteride injections every 1 to 3 months. Preliminary results showed that there is not really a big difference in systemic absorption between oral dutasteride or dutasteride injections via mesotherapy, although the small study sample size might be the actual limitations. So in any ways, there should be further investigation done. After reducing DHT levels in the body, the second best option to fighting the good fight is Minoxidil. Topical 2% and 5% Minoxidil has been FDA approved even earlier than finasteride and is widely available over the counter because it's very well tolerated by most people. Minoxidil is a growth agonist. It does not address the root of hair loss, so as a monotherapy it's not considered as a great long-term solution. Oral Minoxidil can also be used for male pattern hair loss. It's available only as off-label prescription because it has more potential side effects, but it can work much better than topical version. Most common doses that are very well tolerated by most people and prescribed by various doctors are between 0.6 to 25 mg twice a day or up to 5 mg once a day. Most people will see great results only from topical version. However, if someone is willing to try out, it can be much more effective. There are other growth stimulants like Minoxidil, peppermint oil, rosemary oil, etc. But comparing to research, they can provide very minor boost if any compared to Minoxidil. Microneedling can be a very good addition to your Minoxidil routine because it promotes blood flow, collagen production and growth factors via wound healing. Its best use is once a week with 1.5 mm needle length. And there are 3 types of microneedling devices: Derma Roller, Derma Stamp and Derma Pen. All of them do their job, although some of them might cause micro-tearing of the skin. The safest of them all would be a Derma Stamp, because it goes up and down with the pressing motion. There is no other mechanism, but it also can take a lot of time to cover the whole area. And Derma Pens can be more superior because they've got a micromotor and really fine needles, so it's much easier to cover a bigger area, although they can create a dragging micro-tear in the skin. So after reducing DHT and giving a growth boost, the 4th best thing you can do to target hair loss locally would be via topical antiandrogens. Antiandrogens work by competing with DHT and T in scalp in binding to androgen receptors. They don't stop androgen productions in the body, but rather take their place. The less DHT and testosterone will bind to your androgen receptors on scalp, the less hair miniaturization will be experienced. While this method sounds like the best way to go about hair loss, basically, it hasn't been shown really to treat male pattern baldness as well as Minoxidil and finasteride. The most common antiandrogens are RU58841, CB0301, also called Brizula, fluoridil and alpha-tridal. There is no much research done on RU, however, anecdotally, it's been shown to work really well and it's the strongest of them all. CB0301 is currently undergoing clinical trials for FDA approval in treating male pattern baldness and should be available around 2023. It's been shown to be weaker than RU, but it has potential to have less side effects. Other topical antiandrogens have much lower binding affinity, so they're not gonna be working as well as RU or CB. It's worth mentioning though that currently, at this stage, none of the topical antiandrogens are being approved or cleared by FDA for treating hair loss, so we don't really know what can happen or what kind of side effects can occur by using them long term. So I would stay a little bit cautious about it. All of them are considered experimental and the only way to buy them right now is through grey market like a website. And so basically you don't really know what you are getting. Like I've seen some claims, people saying that they instead of receiving 99% purity, they test it in their own lab and they got like less than 50%. So they've got a reputation of keeping potentially a poor safety and quality practices. I think right now it's best to wait when Brazil are gonna finish their clinical trials and will be approved by FDA. So we're gonna have a proper high quality topical androgen that actually works. There are quite a few other possible treatments for treating hair loss that are currently in research mode. Folica, KY19382, Samomet, Shiseido, etc. It's worth giving a shout out or honorable mention to a couple of other treatments that have potential, but they lack studies or been shown not to do much. And one of them would be Sopomet, obviously, which goes also by Sereno repens in most of the studies. It's marketed as a natural alternative to finasteride, but it does actually exactly the same thing by reducing DHT through 5-alpha reductase, so the side effect profile is pretty much the same. Although it's nearly not as effective as finasteride, and most of the time it's not gonna be even enough to get any positive effect. PRP, or platelet-rich plasma, it's a derivative from your own blood basically. They're taking your own blood, they're putting through centrifuge and injecting back to your scalp. There are some doctors that are actually finding a huge success with this, but most aren't, because not every PRP has been created equal. Currently there are no standards of what's the best dose, how many platelets or frequency, etc. So we really don't know, and most of the time it's just gonna be a waste of money. It can get very expensive to keep up with it long term, with relatively small success rate. So, it's up to you. Low laser light therapy, or LLT, has very little evidence that it can actually do anything to you, but again, it does not have any side effects, except slimmer wallet. Ketoconazole shampoos can be beneficial of keeping your scalp overall healthy, without any inflammation on dandruff, etc. So there's less factors contributing to your hair loss. Overall result, it can be as good as 2% Minoxidil, although because most of the time it's in the shampoo version, it does not really do much. So again, won't harm, keep it for at least 10 to 15 minutes on your head, but don't expect any miracles. Pumpkin seed oil, tea tree oil, nettle extract, caffeine, biotin, pretty much any other vitamins that are claiming to stop or slow down your hair loss, they really don't work. And again, it won't really hurt using them, but again, the only side effect you're gonna experience is gonna be a slimmer wallet. DHT blocking shampoos are another hoax that are purely designed by marketing to empty your wallet. Any topicals have to stay for a substantial amount of time on your scalp in order to be effective. Moreover, shampoos never have a good vehicle to even penetrate the skin so you can reach your follicles. And that's pretty much it. Sadly, in 2021, we still don't know the exact cause of hair loss, and we still don't know what's the best way to stop it completely or reverse it. So the best thing you can do right now is to be proactive and treat your hair loss as early as you can. Early intervention is key for long-term success. So stop wasting your time, hair and money on any natural things or any other snake oils and start using what's been proven to work. And if you got any questions, make sure to leave them in the comments down below. Subscribe to the channel, like the video, and I'll see you in the next one.